Hello, I'm Paul Kokety. In this video, I'm going to introduce talking about craniosacral therapy, which is one of the primary techniques that I integrate into my massage and bodywork sessions. I'm making this video because I consider it one of the most profound techniques for creating deep releases down through the core of our body. And it works with tissues that people just don't really understand or know about. And it works with those tissues through areas of the body that people don't know there are therapies for, or they have reservations for being touched or worked with. There's also a lot of mainstream opposition out there toward craniosacral therapy. This video will start to address all that to help educate you on the importance of integrating craniosacral therapy into your body work sessions. If you have deep ongoing problems that you're just not getting lasting relief for, chances are those mainstream techniques out there are missing the very deepest layered tissues of the body and what I call the marionette effect. This video will start to talk about all that to show that importance and what you need to do to really create a more holistic approach for working with the body. So, what is craniosacral therapy? Basically, I look at it as simply being stretching or range of motion of the skull. Now, as the name implies, there's a cranial portion, the head, and then there's a sacral portion, the pelvis. This video, I'm just talking about the cranial portion because the video will be more than long enough as it is. I don't want your heads to explode from too much information. There will be more videos to come. Stay tuned into those if we're talking about the pelvic portion and also talking about what I call the marionette effect and how the tissues go deep down through the body and what is being missed, what we need to do to integrate to create a longer lasting results. Those videos are to come. Getting back to this though, what is craniosacral therapy? Like I said, it's simply stretching or range of motion of the skull. It's no different than if you want to try stretch your hips or shoulders to release tightness, to help rehydrate the tissues, release tightness in the muscles, take pinching off of the nerves. It's the exact same idea, it's just a much smaller scale. But with this, we can create really profound changes. The skull, it's not a fixed mass of bone. It's a living, breathing system. It has to be that way to help pump fluid around your brain and spinal cord, and also to help balance out pressure changes in the atmosphere, help drain the sinuses, and also the pumping action, just like the breathing of your ribs, of your torso. The contraction and relaxation of the skull helps to release tension from the muscles. If there's a range of motion to an area, you can work with the bones and the joints to stretch the tissue that's creating restrictions affecting mobility and functioning. Exact same principles here with the skull. Craniosacral therapy works with that range of motion to release tightness around the tissue of the skull, throughout the skull, but also inside in the meninges, which are the layers that surround and protect your brain and your spinal cord. The outer layer, the dura mater, is the inside skin of the skull. It folds in on itself to help compartmentalize the brain, so it actually divides your brain. It penetrates deep down through there. With this range of motion, I can start to release all the way down through the center of the skull to help with a variety of issues that I will talk about a little bit later. So, as I said earlier, there is opposition to the techniques out there by mainstream medicine, but it's just not true. Mainstream medicine says that the sutures on top of or surrounding the head fuse by, it varies on the source. Some sources say the 20s, 30s, 50s, but it's just not true. The range of motion is there, even in the 80-year-old skull. All you have to do is simply hold the skull in your hands and you will be able to feel a subtle pumping action in there. If there's a movement there, then there has to be movement in the joints. It's not that hard to understand. Very easy concept. The problem is probably the doctors who came up with that ruling never held a living, breathing skull in their hands. They were studying dead bodies, cadavers. But not all doctors think that way. Osteopaths actually documented that there was movement, contraction, and expansion of the joints and movement of the bones in the skulls when they were doing brain surgery, at least dating back to the 1890s. From there, the osteopaths developed osteopathic manipulation, and then from that came cranial sacral therapy, and then from that came very specialized techniques, some of which I do for posture problems. And so why talk about all this? What is it? Is the significance of it? And what are we working with? I will get into that in a moment, but first I want to talk about pressure imbalances caused by trauma, specifically to areas of the body where there are cavities. We have a few main cavities to our body. Our thoracic abdominal cavity that contains the majority of our organs is one big cavity, but then there's another cavity that contains your brain and goes down through your spinal canal for the spine. So you have two main cavities, but skipping the body portion and just talking about the head, when traumas happen, there starts to be pressure imbalances within cavities. And it can create all kinds of effects, anywhere from cognitive issues, neurological dysfunctions, emotional issues, structural issues. In the case of the skull, stuff like TMJ. All that is affected by pressure imbalances within the cavity. So, to start to think of this and, what causes this, I'm going to do a comparison here. Let's think of a tube of toothpaste. For toothpaste, we want to create a pressure imbalance so that way we can squirt toothpaste out of the opening, correct? You squeeze on one end, creating a mechanical inward pressure to squeeze the toothpaste in, and then in the other area closer to the opening you get an outward bulge. I believe that's called a hydrostatic pressure. That's a pressure from the inside being exerted outward. So two different types of pressures being exerted. That creates an imbalance there. In toothpaste it serves a purpose, but the thing is, when it happens in our cavities, the cavities of our body, in the skull or in our torso, we get various problems happening with our nervous system or with our organs, difficulty breathing, with digestive issues. We get herniations in our abdomen. We get sexual reproductive issues down in our pelvic cavity, or urinary issues, incontinence problems. Start to understand? Hopefully it makes sense to you. This is all very important, and it works with tissues that are the deepest layers of the body, the core of the onion, so to speak. Where does this distortion and the imbalances come from? Basically, life has its many traumas. A lot of stuff happens very early, even before you're born. If you were a difficult delivery, if your head got stuck on mom's sacrum as you were trying to be squeezed out, and it was stuck there, the contractions jam it deeper and deeper into her sacrum. In several of those cases, you end up being a C-section, but if you manage to be born natural, vaginally, your head gets compressed inward to squeeze out a mom, and then after you're born, hopefully it fills back out to be a more balanced shape, balanced pressure. If it does not, if there's distortion that happens from the birthing process, or let's say that they use a forceps or a vacuum to help deliver you, or whichever baby, then there gets to be distortion. And if it doesn't balance out, it's like the uneven pressure from the toothpaste. Then slowly, over the first 6 or 7 years, your head calcifies to harden and the bones take shape to become the bones we know of in the adult skull. That distortion gets set in there and can create all kinds of problems. So craniosacral therapy helps to work with that very early stuff, but it also helps with stuff that happens later. If you were a kamikaze baby, any falls you had through life, any car accidents, or even brain surgery or dental surgery, that all creates restrictions in here. In the case of brain surgery, the scar tissue underneath the area of the bone that was removed will actually pull that in a bit in the area. Craniosacral, I've used that even on brain surgery to help fill out those bones to have a more balanced shape. How is all this possible though? Like I said earlier, the skull is not a fixed mass of bone. It's a living, breathing system. All these sutures have a very specific design to allow the skull to rock around a master joint in the center of the skull. The main rocking action is that the front and back rock up and down a little bit. The frontal bone here, the forehead, and the occipital bone in the back. That creates a pumping action that's known as a cranial sacral pump. Sacral is in the name because the meninges, the dura mater, attaches down onto the sacrum. So your sacrum actually rocks a little bit with your skull to pump the fluid. So it helps with that. It helps with draining the sinuses. It helps for releasing tension by the constant contracting and relaxing of the skull. The muscles help to relax. And then it also helps out with pressure changes, stuff like that. If you have a nice balanced skull, then it's a nice clean hinge movement that happens. If there's distortion, then it has a little twist to it. Or it can collapse into one side instead of rock up and down. So everything has a very specific design here for functioning. What allows it to be possible? Straight in from the skull, or straight in from the jaw or the ears, there's a master joint right here between what's illustrated as purple and yellow. This purple bone is the occipital bone. It's a base and back of your skull, like a spearhead pointing up. It matches your sacrum that points down. Then the other bone is called the sphenoid. It has wings that peek out here in the temple area, and it's also part of the eye socket there in the back. This is the master joint. It's a flat joint with cartilage. It has a little twist to it from being a flat joint, twisting action that it can go through, but the cartilage allows for the main pumping action up and down. As a sphenoid rocks up and down, it brings the forehead with it. The facial bones also have movement in them, but I'm not talking about that here to keep it short or shorter. I may have an additional video about that. And these other sutures also have a purpose. They mostly support that central motion, but again, skipping that, that's a master joint. So that's what we work with. With that master joint, it's down behind your pituitary, so I can release tightness all the way deep down through the skull, how the meninges compartmentalize the brain, help release tightness around the pituitary so it can function better for hormone regulation, neurotransmitters, stuff like that. This is the very basics of what craniosacral therapy is working with. So this is the core of the body. This is how we address the body from the inside out to create a more complete therapy. When you do it with other things, in my case, I mostly integrate it with myofascial release, although I actually just consider craniosacral therapy just another form of myofascial release. I'm able to create all the more profound changes for helping people. It helps with cognitive issues. I've helped with autism, ADHD, neurological issues I've been able to help with, like Parkinson's, cerebral palsy. The easiest way to describe it is that this helps to organize the chaos. Other issues like tinnitus, vertigo, Bell's palsy, trigeminal neuralgia, I've helped with all those. But I can also work with postural issues or structural issues like scoliosis. Also, in terms of working with the spine, it's phenomenal with stenosis, which is the narrowing of the passageways for the nerves, whether it's down through the spine or where the individual nerves exit to go out through the body. In that case, I actually almost have a 100% success rate, even with people who have already had surgery. So it's really phenomenal. It's taken my ability to help people to a whole new level by integrating the techniques. In my case, I do a lot of specialized cranial sacral techniques that are differentiated a bit by calling them cranial structural. I'll get into talking about that in other videos to come, so stay tuned if I have your interest. Hopefully I've kept this interesting. Please contact me with any questions, and I look forward to helping you in any way possible. Be well.